Knock, knock.
Come in.
Good morning. Hi, I'm Brandy. I'm going to be your student nurse today.
Okay.
How are you?
I'm all right.
Okay. Can you verify your name and date of birth for me?
Misty Miller, 4/25/93.
Okay.
My stomach kind of hurts.
It does. Let me just check your armband. Okay, Miss Miller, that matches what we have in our system here. And do you have any allergies?
Penicillin.
Well, we are not going to be administering any penicillin to you today. The doctor has ordered an NG Tube placement, okay? And it's gonna go through your nose, down your throat to your stomach, so we can get some meds and some feedings in you, okay?
Okay.
Okay. Can you open your mouth for me? Okay, mouth looks free of lesions and pink. And I am going to take a look up your nostril. Okay, nostrils look clear. And I'm just going to have you take a sip of water to verify you can swallow. Okay, patient swallowed. And now I am going to assess your bowels, okay?
Okay.
Okay, have you ever had a broken nose?
No.
Okay. And the abdomen looks a little distended. Okay, and I'm putting on my stethoscope. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, thank you for that. And do you have any questions for me before we get started?
Is it gonna hurt?
No, it should be fairly seamless. It might hurt just a little bit, okay? I am gonna go ahead and put this towel right here just in case some stuff comes up. I'm gonna put the basin right here in case some stuff comes up, in case any fluids come up, and I am going to start by measuring this.
Okay.
Okay, and I'm going to start at the tip of the nose. I am going around the ear and down to the xiphoid process. And then I am going to mark it with my tape. Okay, now I'll cover you back up with the towel. Here's this. And then I will come over here and I will put my gloves on. Nope, this should be fairly quick and it should be fairly seamless, okay?
Okay.
Okay, so I'm taking this, I'm lubing it up here. And whenever I'm going in with my tube, if you could just keep swallowing for me, okay? Just swallow, swallow, swallow.
Okay.
Okay, 1, 2, 3. Swallow, 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 swallow. Okay, thank you for that, Ms. Miller. And now I'm going to call X-ray. X-ray, can you please verify placement?
It's in there.
Okay, wonderful. So X-ray has verified placement. And now I am going to verify suction on the wall over here. The doctor has it set at intermediate. Okay, and there is suction. next I am going to verify for my own beings with putting a little bit of air in there and making sure I can hear it. Okay, I can. Okay, and then next I am going to give you your meds, okay? If it becomes clogged, then I would stop and I would just, if this becomes clogged, I would flush it with warm water. Okay, here's the meds. Here's the water, 30 mils of water going in. Okay. Okay, and then I'm pulling it out. And now I'm putting the meds in. Okay. Put that back down. The meds are going, meds are going, meds are going. And now I'm doing my 30 mils of water again. Okay, the water is going, the water is going, the water is going. Okay, and now I have waited some time and I am going to do my feeding. Okay, so my 30 mils of water before the feeding. Okay, and if now I can put my feeding in here. Okay, and the feeding's going. And now I am doing my 30 mils of water flush after the feeding. 30 mils of water after the feeding. Okay, thank you for that, Miss Miller. And if you do not need anything else from me, I will be back in a few days to check on you.
Okay.
Okay?
Thank you.
You're welcome. Okay, I'm looking out, I'm lowering the bed. Here's your call light. I am moving my towel in your little basin in here. I've given you the call light. Okay, and I will see you shortly.
Okay.
Pumping my hands for hand hygiene. Knock, knock.
Come in.
Hand hygiene, close curtain. Hi, Miss Miller, how you doing?
Good.
Wonderful.
Better now.
Are you? Yeah, you're getting that tube out today, Miss Miller. Can you verify that name and date of birth?
It's Misty Miller, 42593.
Okay, and do you have any allergies?
Just penicillin.
Okay, and I have raised the bed up for proper body mechanics. I put the call light right there. Okay, this should be fairly simple. Okay, so whenever I'm pulling it out, if you could just, you won't even feel it, okay? Just deep breaths. All done.
Marvelous. I was just seeing who all was in here. It's about that time. I'm out of here, so if you